Thank you so much for joining. Today's topic is on Beyond Detox, healing the mold toxic body when everything makes you react. And this is a common complaint in clients where they have worked with multi levels of supplements and practitioners and different things that they have looked through in the internet or Instagram, and as well as doing their own searches. They can't seem to find out what is really happening, right? They've decided to do mold testing. They've done all these different protocols, and as well as some of the supplements that I recommend doesn't seem to do the trick. There's some kind of missing piece here, and that's the part that I'm going to be discussing tonight. So the objective for today is to understand the pathophysiology, what's really happening within the body and your cellular level in dealing with mold toxicity, but specifically immune dysregulation. Identify the common mistake in mold detox protocol, right? And as well as learn about the ENCORE method. What is this ENCORE method? How does it actually help me to recover? And what kind of approach does Dr. Kim actually do? And as well as lastly, is to gain clinical pearls for sensitive, non-responding mold patients. And I'm quite sure one of you are, or many of you are on this call, many reasons why you're here to talk and learn about this. My name is Dr. John Kim. I'm a functional medicine pharmacist and a practitioner. I've been in clinical practice for almost 20 years, and I end up having to specialize not only on the root cause aspect of it, but specifically in the context of mitochondrial dysfunction, cell danger response, stealth infections, and specifically drug-induced toxicity. For many years, I've also worked with clients dealing with autism spectrum disorder, almost 20 years of clinical practice and managing some of the complex disease states out there and connecting with clients and really figuring out what the root cause issue is. So I mentioned about it early on. Hopefully the microphone was working when I shared the story, but back in 2015, now it's been 10 years so far, I had a heart attack, and that was something that was very challenging for me to accept, right? Because one, I was pretty healthy, I was fit as can be, I thought I was doing everything I'm supposed to. Unfortunately, that was not the case at all. And one of the things that became a challenging point was that I had a 85% blockage in one of my arteries, and that was really baffling the physicians I was working with. And they didn't know what was going on except for, all right, this guy needs a stent put in and then heavily medicated, but I wanted more answers. And this is where I decided to dive in, doing additional blood tests with my functional medicine doctor at that point in time. And one thing that we found out after the blood test came back was that I had a positive high levels of mold antibodies, specifically Aspergillus, Bartonella infection, which is cat scratch fever, Epstein-Barr, Mycoplasma pneumoniae, heavy metals, right, especially aluminum, mercury levels very high, and lastly was a parasitic infection. So it took me about 2 years to clear out. And it was just so challenging. Is one, it's not even just the fact that I was recovering from a heart attack, but the overall detox protocol that I was going through was very harsh. And it was something that I end up having to have many challenges where I end up having to stay home for hours, days, and I had to take off for 4 months from work. I still own a compounding pharmacy, but at that point in time, it was very challenging, not even just mentally, physically, but also financially, right? Everything was just completely been halted and I couldn't make the living that I need to. So what I learned from this point was that after going through my own health journey and finding out that the mold was the biggest impact into causing the mitochondrial dysfunction and then cardiovascular disease I was dealing with, that comprehensive, at least complete healing is not possible, is impossible without addressing the mold issue. Why? Mold actually plays a big envelope in invading every parts of the body, right? It's not just about parasites, but also mold issue as well. And when you look at the downward spiral of effect of inflammation along with other challenging issues into leaky gut, having to do with neuroinflammation, and then if you have any other manifestation like autoimmune disease, it becomes even more difficult. And use of proper testing and clinical assessment is key. And this is where trying to figure out what the root cause issue is. And I have no issue with muscle testing. But usually what I keep noticing is that mold issue is completely overlooked by muscle testers. I'm not sure if this is overall skill set, or is it because of mold resonating lower frequency that some of these muscle testers are not able to test out, and it's completely miss it. And I've actually had a call this afternoon with a mother who has a 17-year-old child dealing with mold issues, and same thing. The muscle tester completely overlooked that process, and it was a problem. And lastly, to support the cell membrane health and integrity is the biggest thing that I learned from there. And lasting difference in my health is complete freedom from mold. So freedom from mold is possible. I've done it myself. I've done it for other clients. Usually now, the actual therapy and the things that we use in terms of protocol-wise is so hyper-focused now that usually takes about 5 to 6 months to clear out some of the clients, as long as it's not very complex. Right? For complex cases, could be around 9 months to 12 months, but still, the amount of time that you might have lost from doing all the protocols, and you've been doing this mold, quote unquote, mold cleanse for 2 to 3 years, it's a lot of time and effort and stress you're dealing with. So this is where hyper-focusing on it is a structured program that I'll be presenting to you today for you to learn. So what is mold toxicity? And then as well as what's the difference between that versus the mold allergy? There's a cellular perspective there. What does that look like? Mold allergy deals with IgE-mediated type 1 hypersensitivity issues, right? Typically, you have ear, nose, throat issues, especially sneezing, congestion, watery eyes. And you could detect it by doing a skin prick testing or some type of serum IgE testing. But when you're doing mold toxicity specifically, it's caused by mycotoxins. These are non-protein, non-IgE toxins, usually the volatile gases that are also being very lipophilic, so it could accumulate in the cell membrane, the mitochondria, the brain, and the fat tissues. This reason why alone is very difficult to clean mold toxins. If you think that just taking binders alone is going to be decreasing the issue of mold, it may, but doesn't go specifically deep enough to get to the root of the issue. This reason why the title for today is Beyond the Detox, right? Beyond the conventional detox that a lot of functional medicine providers end up having to talk about. And this is where the chronic systemic dysfunction come into play. And how does mycotoxin disrupt cellular membrane? It actually causes lipid peroxidation. What does that mean? It actually increases reactive oxygen species to oxidize. So basically, it's burning that cell membrane. It's comprised of fat. And that damaging issue can result in your membrane, your cell membrane, right? If you look at the actual drawing here, is made of bilateral structure of 2 layers of fat. Think about this. When there's inflammation going on, when there's fire going on, if you try to burn fat or sugar, what does that do? It gets oxidized, gets very tarry and black, and then it becomes hardened. That's exactly what's happening in your cell membrane. And this is what mold can do to you, right? That's the reason why you cannot detox very well. And this also triggers a phenomenon called cell danger response, initiating an inflammatory cascade and mitochondrial shutdown. And cardiolipin damage is another thing as well. This essentially is a phospholipid, right? Another set of fat in the inner mitochondria within here. It gets oxidized, gets damaged, and that particular mycotoxin, especially ochratoxin A and aflatoxin B1. If you have done any urine mycotoxin testing, you're pretty familiar what these are. And specifically, ochratoxins are very high levels of this can be detected in conventional coffee, right? It actually causes additional damage to the cardiolipin, which is very sensitive to these type of toxins, and also impairs the mitochondria from making energy, especially electron transport chain, to preventing you from ATP production, so basically energy production. And the mitochondria plus the cell membrane has to be the primary target that you want to look at. Why? Because mold already knows that these are the things that they need to target to destroy and for them to invade. And this is what molds do. They invade everywhere, right? And ochratoxin, especially coming from Aspergillus, it actually inhibits the mitochondrial respiration, right? Your cells has to breathe, and unfortunately, that's not possible. It promotes lipid peroxidation. So lipid, the fat layer in the cell, gets burnt. And aflatoxin B1, which can be prevalent in wet building along with some of the food like grains and rice. It causes mitochondrial membrane disruption. It's also mutagenic, right? It can cause teratogenicity in fetal development, as well as impairing hepatic detox. It can cause cancer from this particular part. There are studies showing mold are interlinked to DNA damage, which can result in cancer. Trichothecin, which is a black mold, inhibits protein synthesis. So you cannot produce proteins correctly in the body. If you're lacking in that, you need protein to detox. That's not happening. And also disrupts your fat bilayer structure of your membrane, and also causes cell death to occur. And zonulin, which is it actually mimics estrogen. It inserts itself into the overall fat layer structure. It also changes the cell signaling. So the cell-to-cell communication is not happening there. And then lastly, the most impactful thing that I see in young women who are trying to get pregnant and they can't, and they find out that they're dealing with mold toxicity, zonulin actually causes reproductive toxicity issues there. So clinical takeaway is that there is a major cellular impact. And this is a part that's often overlooked and missed, especially when you're doing any type of shoemaker protocol where they use cholestyramines and any of these type of very harsh binders. It's going to cause more further damage in the cellular impact, especially the cardiolipin and the phospholipid bilayer structure. So mycotoxins target the membrane integrity first. And this is what mycotoxins do. They are so smart. They already know what to target. So this way they're able to invade. And that's the part that's so difficult for a lot of practitioners to understand, because if you're not looking at this in a more of a cellular level, you end up having to miss a lot of things. So this is a part that I'm going to teach you further about tonight. And then second, it requires a comprehensive approach. Not only that, in terms of rebuilding your cellular membrane, utilizing phospholipid. I talk a lot about body bowel PC, DA phospholipids, antioxidant therapy as well. Glutathione, sometimes you have to be very careful with mold toxins in patients because they could cause massive amount of die-off reaction from the mold and you get severely sick. But your basic thing is that your cell is not able to handle some of these damaging issues. And then there's a mitochondrial repair and redox balance is also affected as well. And then the scientific literature, there are articles after articles available. So if I'm not making any sense, here are some of the copies of the articles that I put together for you here. The number one mistake that a lot of practitioners and clients who try to do this on their own, especially, they're focusing on just killing mold, right? Mold is a big problem, but you cannot just focus just on killing mold. The conventional approach is to using antifungals, binders, and glutathione. But if you have a problem with the host terrain, right? If there's a mitochondrial dysfunction going on, there's a leaky membrane, a dysregulated immune response, especially there's a Th1 and Th2 imbalance and causing autoimmune disease, the patients are going to crash, or they end up having to get worse when they do any type of detox work there. Right? Next is number one, two mistake is ignoring the nervous system dysfunction, right? Your nervous system, your limbic system, so the vagal nerve often gets stuck in a chronic threat mode. So the concept of cell danger response is so critical here, right? Especially when you look at the root cause, the developmental and relational trauma that you actually have. Could be physical, emotional, mental, it could be sexual trauma that could be dealing with. These are a really important part. Have you had any issue dealing with parental ignorance when they're growing up? If their emotional needs are not being met from the parent standpoint to the child, this can cause neuroinflammation. And when you're adding in mold on top of EMF and other infections there's a whole toxic limbic looping where it amplifies the symptoms and the reactivity. So there's a clinical manifestation. So mold can cause insomnia problem, but so can nervous system dysfunction from the past traumas along with the mold. So insomnia, POTS-like symptoms. Very often I see these symptoms of people, anxiety issues, and then cannot tolerate any supplements. They come in with lists of supplements they cannot take. So patients are reacting to one drop of binder, and then the limbic system interprets as being a threat. So they go into a hyper reflexive sympathetic cascade, And then the symptoms gets worse with these clients there. And number 4 is to overlooking the environmental factors. What does that mean? Why do I need to look at the environment? Blue light exposure, right? When you're looking at toxic blue light from LED screens to your cell phone and such, these type of toxic blue lights end up having to suppress the melatonin, which is needed for circadian rhythm, but also help to regulate your mitochondrial autophagy, right? Melatonin is very important. It also increases, blue light increases reactive oxygen species. So there's an inflammation going on there, stress response to the mitochondria. It also alters the circadian gene expression, right? So this is going to be a problem, especially when you're looking at SIRT2 there's a particular marker, gene expression, that a lot of longevity doctors looking at, and they're telling patients to take something like spermidine or NNM to increase SIRT2 expression. But what's happening right now? Blue light, which you're getting bombarded with, can cause that issue as well in decreasing that expression. So would you rather spend money on a supplement or try to get rid of the things that's already stressing your body? I would pick the latter and go with that. The reason being is it could also affect you from doing mold detox properly as well, right? This could also affect your leptin resistance. EMF interference is another thing. It disrupts calcium voltage-gated, ion-gated channels, intracellular calcium leaking. So your minerals are basically getting wasted, affects methylation enzyme expression, redox regulation. It also reduces ATP output and worsens the oxidative stress. And patients living in an EMF-heavy, blue light-saturated environment cannot repair mitochondria. This is an important part that people are having trouble wrapping their heads around. This is a 21st century issue of environment and pollutants. I'm talking about bombarding the entire system in your body with EMF exposure and blue light, which is no good for any type of detox work. And people are getting sick because of that reason. Number 5 is skipping the resiliency building point. Right? What does that look like? You need to rebuild your body. If you don't, you're going to keep on having to react to the environment itself. And that's not what you want to achieve. You want to be building a resiliency so that you're able to restore your immune tolerance, you're able to regulate your nervous system better, as well as the resiliency practice of doing breath work, red light therapy, circadian repair, mineral balancing, emotional work. All these things are supposed to help you regulate your body correctly, right? You're not supposed to be on a mold protocol forever. And this is the part that people don't seem to understand here, right? Everything in terms of the cell danger response and what I'm going to introduce in terms of what ENCORE Method is about is all into building that resiliency in your body. So this way you are able to function better, you're able to live your life. I don't want to ever see you again after a certain amount of months of working together. Why? Because I want you to be independent for yourself, to be healthy, to live your life and enjoy, to travel, build, create. But if you're constantly getting sick and reacting and not having the overall resiliency within the body, within the spiritual aspect of it, all that can leave you completely broken. And I don't want you to do that. I want you to really live your life properly here. And that's the reason why I'm doing this. Number 6 is ignoring the cofactors. What is that? Trauma, EMF, gut dysbiosis, viral reactivation, biofilms. All these things are called to mix if you're just addressing killing mold, right? I'm talking about mold, but it's not mold at all. I'm talking about the comprehensive approach in terms of how the body's functioning here, right? So mycotoxin pathophysiology is a molecular chaos. It's lipophilic, it stays in the body, and end up having to stay in the fat, right? It accumulates in the cell membrane, all that. And even if so this is a part, like you could move your home, and this is a part that people get confused about. You could move your home, you could change your diet, but you could still carry that mold with you inside the cells. So the same call that I had this afternoon, the parent actually had this child living in a moldy house for 4 years. They got out, but the kid is still sick. They're still reacting. His mental health gotten better, but still sick, low energy and such. Why? Because the mold issue is still harboring in the body, right? So that's the part that I have to address with clients. Molecular mechanism of damage as well. There's a glutathione depletion going on, oxidative stress, block protein synthesis, mitochondrial dysfunction, right? No one talks about a lot of these things, but I actually address these things step by step in teaching clients to do this. And then when you talk about neuroendocrine and autonomic nervous system, when you have high levels of stress, especially elevated cortisol level, there's an HPA axis disruption, which can result in immune suppression, gut dysfunction problem. So a lot of clients deal with small intestinal bacterial overgrowth, followed by small intestinal fungal overgrowth as well. And the long-term exposure, it burns your adrenals. So having to deal with chronic fatigue issues, not just about viral infection, it could be mold. And then when you have a limbic sensitization where there's a constant neural inflammation going on, it actually increases your limbic reactivity to stimuli. So you're hyper reflexive, right? So you might be lashing out at people, or maybe you're taking a new supplement and you're having all this reaction. Those are all part of this whole limbic sensitization. And vagal tone suppression as well, impaired GI motility, detox, and increased risk of SIBO, MCAS, and histamine access as well. So it's not just about the mold, but you have a major neural inflammation and neurological issues that I have to address these things on. So I actually do a lot of breath work with clients, and I do a lot of these autonomic nervous system retraining for clients. So this way they're not reacting to the environment. So they could feel calmer and feeling safe. You heard that word safety? That's what body wants, right? That's what we want, right? So that's a part that I want to really teach you here. And body perceives mold as a trauma, and mycotoxins make the nervous system hypervigilant. Crossing the blood-brain barrier as well. Mold actually penetrates into the brain, and these mycotoxins end up having to cause microglial activation, neuroinflammation there, inflammatory cytokine production, releasing of other inflammatory cytokines, especially TNF-alpha, and then nitric oxide. You might be wondering, nitric oxide is good. It vasodilates. Nitric oxide, having too much nitric oxide, can cause massive amount of oxidative stress in the cell, and it can cause cell death. That's not good, right? So brain fog, anxiety, panic disorder, insomnia, depersonalization, right? Exactly what this mother said this afternoon. After a certain amount of time, my son was never the same, right? So this is a part that depersonalization actually can occur from mold issues due to brain inflammation, right? These mold toxins have to cross the blood-brain barrier and causing this problem. Memory issues along with mood disturbance as well. So neuroinflammation are interlinked to mycotoxins. And for those sensitive clients who are reacted to everything, or maybe you have an HLA genotype, there's a genetic disorder, a genetic issue where you have trouble getting mold toxins out. If you have multiple chemical sensitivity, that's a limbic system activation where odor and toxins end up having to be activating multiple issues in the body, along with histamine intolerance, poor tolerance to supplements, trauma background as well. If you have past trauma from physical, mental, and spiritual trauma you might be dealing with, this actually increase a heightened amygdala response in limbic looping. So limbic aspect of it is constantly getting to fired up and a hyper vigilant state of trying to figure out, is there anything else that's going to be causing a threat to my body? And when you are locked into that sympathetic dominance, it actually is a constant overload of cortisol and adrenal spike. And then when you are measuring your HRV or heart rate variability using an Oura ring, it's going to be low all the time. And that's that impaired vagal nerve recovery process. So why am I talking all about these things? The terrain is very important, right? You need to stabilize your terrain, your body, right? Your humanly body that the God gave you, right? That part, the image of God that we're born into, that is a terrain that we need to stabilize first in order for you to recover. And that sensitive patients do not need more aggressive healing protocol. They need nervous system regulation. They need cell membrane and mitochondrial repair. And they need resiliency to build this particular habit so this way they could live, right? So treating the nervous system before the immune system. It's a new concept, right? Why am I doing the nervous system? The nervous system, I just mentioned before, is interlinked to your immune system, right? If you're in that hypervigilant stress response state, if your body and your nervous system does not feel safe, it's very hard for your immune system to work well, right? So you need to create safety before the stimulation. So the ENCORE method I want to really introduce is the newfound program that I've been really implementing. So every client that I have nowadays, and in terms of the recovery process and the things that they are now experiencing, is so profound. The ENCORE method is a framework. It's a 6-phase process to addressing mold toxicity, but also a full cellular recovery in your body. So what is that? It's an acronym, right? So E, the first E, is to deal with the environmental optimization, right? So removing the exposure of the sources and create a healing space so that you feel safe. Next is the nervous system regulation, calming the limbic system and restoring vagal tone. After that, the cellular repair is so important to rebuild the mitochondria in the cell membrane, optimize the detox pathway to open up that drainage channel before mobilizing mold toxins, right? I'm trying to get your body back in order to feel safe. And then after that is to rebalancing your microbiome. Everything has to live in a synergy, in a balance, in a harmony, right? Not everything is bad. Neither is everything good is also good either, right? So this is a part that needs to be done. Like balancing is really important. And then also rebuilding that lasting protection against the future exposure, right? So mold issue-wise, you need to really find the hidden sources there. So building material-wise, food sources, environmental impact, where patients never see these visible mold, right? But they're reacting to something, right? So you need to find a right building biologist that you hire to do the right testing for yourself and really keen to digging things through. So this way, if your environment is not clean, doesn't feel safe, you have things to work on, right? This also relates to dirty electricity, right? EMF exposure as well. Your house should feel safe for you to live and thrive. And common co-exposure with mold is that there's a volatile gases from the mold, electromagnetic frequency. So EMF exposure can make the mold issue even worse. And there's some studies where mold end up having to grow even further out when you're dealing with EMF exposure. Wi-Fi radiation, chemical cleansers as well. Some of the harshest cleansers out there can release more mycotoxins, especially if you see mold, anything black on the stand of the wall. Do not use bleach. That's the worst thing you could do. Why? You're releasing these toxic volatile gases into the air and you're getting sicker because of it. Also, a heavy metal exposure is another thing as well. So environmental principle is that you cannot heal in the same environment that made you sick, right? And so creating a low toxin healing space is essential for cellular repair to begin. How to test your environment is a part that I always address with clients. This is part of my mold protocol, is part of my mold course that I'm going to be relaunching next month. And then if you decide to go with the offer tonight, the resources to how to clean out your environment is going to be free of charge for you, but you got to do the right testing in the house. Air sampling, you don't want to just rely on that, but because why? Because these mold and mycotoxins can actually settle on the surface, so you want to really work that through. Moisture mapping, any moisture level above 50% in your house, your risk factor of the mold issue even quadruples. And then also hidden sources as well. Look beyond the visible mold. It could be the dishwasher, under the sink. Any moisture-prone areas can actually harbor a significant amount of contamination. And why nervous system comes first? Sympathetic dominance I mentioned about before. When you're constantly dealing with stress response, this actually causes detox channels to close down. It also releases epinephrine, at least a hypervigilant state where restricted blood flow can occur, also can affect digestion, and it also affects the bile flow. You cannot detox these type of fat-soluble mold toxins very well. And it also decreases cellular repair. So trauma and limbic dysfunction is a big thing that I always work on, right? So doing some breath, not just breath work, but really getting the heart coherency state to be reestablished. So this way you are able to recover properly. And when your body feels safe is when you could detox correctly, whereas when your body feels unsafe, it will not detoxify. Right? So clinical tools to regulate your nervous system, heart-centered breathing technique that I always teach my clients. It's called the heart meth breathing, limbic retraining, right? EMF hygiene is a big one, right? If you're constantly getting bombarded by EMF, especially Wi-Fi signal in a cell phone, that could also affect how well your nervous system is getting regulated. Somatic therapy as well. So body-centered approach to increase the vagal tone exercise is a big one. And then the mitochondria, the mole victim, is your cell membrane, right? So lipid peroxidation, disrupting the structure, the function, and it also inhibits enzymes as well. So there are key Krebs cycle enzymes that is able to utilize to making energy. Unfortunately, that's inhibited, that's blocked, and you cannot create energy either. So there's a cellular impact that goes on. Oxidation, antioxidant depletion as well. So especially glutathione level tends to be very low in these clients. And when I do organic acid testing, I can see right away that this client is having antioxidant depletion. Clinical results are chronic fatigue, chemical sensitivity issues, immune dysregulation, and reduced capacity to detox. So how do you repair the cell? Phospholipid therapy. I talk a lot about body bio. That's one of the things I recommend doing. Mitochondrial support, certain supplementation, depending on how and what's being affecting you is another thing. Red light therapy can be very helpful for you, but some people are very sensitive to red light therapy, so do very slowly and gradually increase. But the most important part is circadian reset. What does that mean? Based on how the sun is coming up. And that particular sun exposure, that particular therapeutic light from the sun is so helpful for you to not only resetting your circadian rhythm, but also supports the mitochondrial function. It's free. God gave it to us, right? But we're so bombarded by stress and environmental issues that we are not seeing this very clearly here. And then the next part is you need to support your drainage pathway before you could detox. So you're optimizing your organs, right? So liver and bile, kidneys, lymphatic system, intestine, and skin is really important part that we have to do, especially when you have a blocked bile. Bile is important not only as a conjugate, but also as a signaling molecule in the body. It also helps to reabsorb the mycotoxins and getting that thing out of the body. But if you have a stagnant bile flow happening, we cannot detox very well. And that becomes where you are overloaded with toxins. Certain protocols I recommend, bile flow support, especially doing castor oil, could be very helpful for you. Do it very slowly. Sometimes doing castor oil right off the bat, too harsh, can cause you to really be reacting. Other things I'm using is ox bile bitters. I like using Tutka from Body Bio. Phosphocholine is very important as well. Phosphocholine, like the Body Bio PC, for instance, can actually increase your bile flow by 230%. Right? It's really essential thing. But the most important part is that your body actually produces its own phosphocholine as well, right? But when you have a stagnancy going on, that part is where it gets affected, and you cannot detox very well. Elimination support as well, gentle sauna therapy, combined with appropriate binders. I didn't say about binders being the number one thing, but when you are affecting positive change in the cellular membrane structure, then you could utilize these binders appropriately. Lymphatic movement as well, dry brushing, rebounding. Rebounding can be helpful. So if you have a little mini trampoline in the house, that's very helpful as well. Why? Because you increase that vibrational state in the body, and your cells are now moving as well. So exercise is very important. So are these some type of lymphatic movement is also key. Mineral support. When you are doing any type of detox, your minerals are going to be heavily depleted. So this is where electrolytes and minerals maintain a proper phase 2 conjugation pathway and cellular function. So this is basically a fancy way of doing further detox work to decreasing toxicity level in the body. And so use of proper bioflavonoids are really important to help to solubilize these mold toxins and eliminate. And it's something that I work with clients very intensely for the first 2 months there. And other things, especially mold, disrupts mucosal terrain, right? So especially when you're dealing with leaky gut issues, mold, like I mentioned before, it causes neuroinflammation. But when you think about neuroinflammation, it also affects the gut lining as well. So it becomes very leaky. Mycotoxins actually break down tight junction protein in the gut. It allows the translocation of lipoprotein saccharides. These are endotoxins, the toxins getting released from bacteria, and these can actually cause inflammation of the gut lining where undigested food particles go into the bloodstream, which can cause massive amount of histamine reaction, food sensitivity, and food allergies, especially. All of these are interlinked to causing cardiovascular disease, neuroinflammation, and all that and more, including autoimmune disease. Also, fungal overgrowth plus gut dysbiosis, right? Common pattern is that there's a high levels of candida, aspergillus, penicillium, clostridia. All these things are really causing mass amount of problem in your gut lining, right? That's the reason why you need to really fix that terrain. And when you're dealing with biofilms as well, biofilms are basically a cocoon that protects these pathogens from other antifungals and other immune clearance, which can ultimately make the therapies very tough to clear things out. So this is a very important part that I also address biofilms as well. And microbiome rebalancing, immune terrain therapy, right? The goal isn't just taking probiotic. In many cases, probiotic can actually make the conditions worse. So number one, you need to remove the pathogen load, right? So you have a targeted fungal colonization you want to really help to address. You may have to utilize pharmaceuticals. If not, some of the herbals can be helpful depending on the type of mold you're dealing with. Phase two is to restore the gut diversity and the integrity. Biofilm is a big issue that you need to address. And lastly is to build that ecosystem. What does that look like? It actually helps to increase nutrients as well as proper prebiotic and postbiotic being formed, especially butyrate production. Sodium butyrate from body bio is something I recommend, but your body already produces that. Unfortunately, when you're dealing with mold issues, that also can be decreased, and that affects your ways to detoxing, digesting food, right? Immune regulation, all that stuff, including your metabolic health. So if you're constantly gaining weight from mold issues, there's a reason why. It actually affects your insulin sensitivity, affects your gut bacteria that also support your metabolic function. Well, it's in a dysfunctional state. You can't control that very well. So this is why microbiome rebalancing and the immune terrain therapy that I just mentioned before is so important. And other forgotten step is resiliency, right? What if you did all this work, but if you're constantly dealing with the toxicity and reacting all these things, that's not good, right? I want you to live. I want you to enjoy your life, right? I want you to gain that freedom from dealing with all these things here, right? So building that resilience is a key thing that I teach at the last. So ability to bounce back from without activation, right? There's no way you're going to be living in a mold-free environment, but I want you to be resilient so this way you're not reacting to it anymore. And also anti-fragility is the end goal, right? Capacity to withstand future exposures without relapsing. So key component that you have to work on, emotional mastery, terrain maintenance, immune tolerance, metabolically flexible, right? Nervous system regulation. So without building the resiliency, clients can actually often experience symptoms reoccurring and just basically living in a loop. That's why enhancing the resiliency is really important that I teach my clients at the end. So how do you build resiliency? Ongoing detox tool, meaning things you just done before just doesn't end, but you are able to regularly do these things on your own without my help, right? So regular sauna session, maybe 2 to 3 times a week. Red light therapy, I do it 2 to 3 times a week as well if I'm not able to get the right amount of sunlight. Intermittent fasting, if you're able to be metabolically flexible, that is. And mitochondrial support nutrients like body bio, PCM, balanced oil. Other environmental hygienes, dehumidifying the damp space, right? HEPA, air filtration, regular maintenance and inspection of the house, and low EMF for better sleep environment, and resiliency ritual like regular breathwork session, prayer, meditation, consistent circadian rhythm balancing, and nervous system reset. Also being active, exercising, weightlifting, those are really important as well. People who are not reacting to a lot of mold issue are the people who actually have good amount of muscle, actually, who are very fit. Why? Muscle is medicine. And so there's a reason why if once you're to recover that process, to build further resiliency in the body, you should do exercise. You should lift. I had this female client, 38 years old. She lived in a New York City apartment with black mold, developed a chronic fatigue, food sensitivity issues, and extreme supplement intolerance. Could not tolerate even a minimal dose of binders. And so she actually was on a cholestyramine shoemaker protocol, and she was constantly reacting. And the initial approach, instead of actually doing all these work, I worked on her nervous system regulation by doing a heart-centered breathing and limbic retraining, and also added in cell membrane support, lipid therapies, so phospholipids and a microdoses to start rebuilding that cellular health back. And intermittent steps are to help support the detox pathway, especially the bowel support with gentle herbals that we gave, especially bioflavonoids are really key here to help her, and introducing some of the low dose binders only. So especially aloe can be helpful here, right? Fibers can be helpful. So those are things that I like using. Even pectin is helpful. So doing more of a gentle approach to allow the body to feel safe and addressing the gut dysbiosis with timed antifungal therapy. And the outcome after 8 months later, it took a while. The reason being is she was living in that moldy environment, couldn't get out of the lease. Right? So I had one lady text message me yesterday on Instagram. She was asking about how to do proper testing and all these different things, especially is anything else that I could do to make a case to get out of the lease. I've been there. So this is a part that we worked on. And then after 8 months, she was able to restore her quality of life and not reacting to the environment and able to thrive. So it takes some time, right? So generally, when I work with clients, it takes about 5 to 6 months. In a scenario like this, where you have trouble getting out of that moldy environment, the process can be a little elongated, right? So it could be around 6 to almost 8 months, sometimes 12 months, depending on how sensitive you are, because you may have to take baby steps to get to where you are. So understand that everything is a process, right? It's not something that you're going to just jump on and then do everything. So that's why this particular topic in the webinar I'm doing right now for you is to really explain there's a missing reason why, right? There's a issue reason why you're not detoxing, why you're reacting to different supplements, why you're constantly getting sick, right? And then you're wondering, what else can I do? This is it. The ENCORE method is a key that made a huge difference in a lot of my clients here. Clinical algorithm, we want to identify the mold exposure and the history of mold exposure as well, right? Thorough history taking, something that I do. And as well as the removal from the exposure or mitigating it is the part that could be somewhat expensive, but if you could easily move out of the environment, great. But that's all case-by-case scenario, obviously. Calming the nervous system, right? Rebuilding the mitochondria in the cell membrane, opening detox pathway, and then after that, addressing the gut and an immune function, and as well as to clearing out and solubilizing the mycotoxins this way, to clear things out and live your life fully, right? So these are all step-by-step method. It's not just about binder. Everything is coming into a unison, so this way you're able to live a healthy life for yourself. So the summary is beyond the detox, right? It's not just about mold, right? So mycotoxins creates a structural cellular damage that affects the body in multiple ways. You need a comprehensive approach. So just not about single approach here. And this is what a lot of practitioners get troubled into. They think that just one single approach is going to be it. No, it's a multifactorial. I call it the 4D approach in many cases. But then the 4D results in a 6-step approach, and this is where the ENCORE method came into play. A standard detox protocol often fails. Why? Because they skip the foundational physiology, like nervous system regulation, cellular repair, and proper drainage establishment. And the ENCORE method is to provide the roadmap that you need, so this way you're able to heal your environment, your nervous system, your cellular repair, optimizing the detox pathway, balance the microbiome, enhancing resiliency, so this way systemically approach to a restored health. So healing begins when body feels safe and the cells have energy and the terrain is restored, right? So I want to give you a little bit of sharing in terms of why I got into the whole ENCORE method is because my overall Christian walk as well. If you think about how, if any of you are Christians, if you receive salvation, if you have experienced that particular journey in terms of your own Christian faith, especially what God, when approached in terms of what God does, especially the Holy Spirit, cleans out your environment first, right? So any bad relationship, anything that's affecting you from having a right relationship with God, he severs it. And then after that, he goes deep into healing your soul, and that's the nervous system regulation. And as was deeper into the cellular aspect, in terms of when you're looking at Book of Hebrews, talk about the double-edged sword with the Word of God. That's exactly the double-edged sword that goes into deep into the cellular and the spiritual aspect into our body, that is able to get us recover to live a victorious life in him. So this is the part that's been a focal point in my health, but also my Christian walk and faith. And it's something that really gave me an inspiration to develop this particular program. I'm not here to push religion. That's not what I'm talking about at this point. But I just want to give you a framework of why and how I came to this conclusion of producing this method called the ENCORE method. Now, obviously, you learned a lot of information, and it could be confusing, but if you want to re-listen to this particular lecture, the recording will be sent to you within 24 hours. But if you want to discuss further, if anything in terms of what we talked about today is resonating with you, if you want to book a call, usually for discovery calls is $250. And that's one-on-one session, 45 minutes, and I go through analyzing your symptoms, your health history, and key dysfunction drivers that you're dealing with, and then give you some of the steps to further going down to the rabbit hole to deal with the issue. But tonight, I want to give you extra if you decide to join me in this particular program. I'm going to give you a free mold nutrient guide protocol. And this is something that I give to my clients who work with me one-on-one. I also include into the mold class that I taught back in January, but I'm going to be re-releasing that course in August. So stay tuned, but this is going to be part of the package for you, as well as the mold inspection checklist. And this is a part that can be somewhat daunting, but it's also confusing as well. You don't know what to trust and what to do. So this is a part that I provide to my clients who work with me one-on-one, so that the mistakes that I made, I don't want you to make on, right? So this is a part that I decide to really put into, give you the tidbits and pointers and such. So this way, it is a comprehensive approach. It's 50 pages long, right? It's guiding you, understanding what the mold toxin is about, how to implement a methodical way of giving your house a recovery. So why actually giving all these things is that I want to work deeper with you, especially for this year, is to make it easy for this way. If clients are, and any one of you out there, and having trouble finding the solution that you want to utilize and recover, and I know it can be very daunting, I'm here for you, right? So just to make it really easy. And so for tonight's offer, what I'm going to do is for all this is for $150, right? So you get a $250 value for discovery call, $50 value on a mold nutrient guide, and a $300 value in terms of the guideline that I put together for mold inspection checklist. All that included, right? And I could probably charge more on these things, but as a webinar special, I'm giving to you for $150. So it's very, very much value added. So if you think about it right now, all that is total up to $600 in total value, including the consultation with bonus material. But I just want to really help more people. But because of the fact that it is a very comprehensive approach that I do, I only have space for 12 people. So if you are wondering, if you want to start working together and all that, this is something I want to really give you ways to work together. So what I'm going to do is I'm going to drop into the chat box for you, at least the chat box, as well as the Q&A box as well. So you could book a call today. And there are certain questions you have to do as an intake, but it's very easy to do. but I want to make it really easy so this way everybody could book a call. Like I mentioned before, I'm only having available for 12 people at this point in time. The reason is it takes a lot of time and effort to do. Just to introduce that ENCORE program takes a lot of time, right? So implementation wise, directing you, coaching you, troubleshooting a lot of issues you might be dealing with. If you start working with me, what I also do is I give you my private number, right? So I give you my private number. Anytime you have any issues, you call me, you text me, right? The reason I should provide that kind of a service is because I've been there, right? It stinks being sick. It stinks when you have questions and reactions and all these things, and no one is there to help you. And so I don't want that kind of stress added onto my clients that I work with. So I decide to include that into the program if you start working with me in the 6-month program. So this is just an introductory call. We're going to book a call. Let's talk. I just put the link for you on the chat box, including the Q&A box as well. And this offer is going to be good for 7 days. I'm going to send another link to on Saturday. Last webinar, there was quite a few people already signed up, and I'm just opening up again for additional 12 people. So if you are hesitant, right? If you have tried everything and nothing seems to work, this is a calling for you at this point. All right. So let's go through some questions. So Bethany is asking, is it possible to create safety when you even react to breath work and meditation? It often causes panic attacks. So that's where you may not be able to breathe correctly because of maybe you have anatomical issues, or you're not able to move your diaphragm very well. So you're not having proper oxygenation. So when you're having lack of oxygen exchange and high levels of carbon dioxide when you're doing breath work, that can cause panic attacks in some people, right? Or they don't feel well after breath work. So this is the part that I coach you through. I see this all the time here. About 90% of the time, people are chest breathers, right? They should be moving their belly and the diaphragm. Instead, the shoulders start to pop up when they're doing breath work. So what's happening? Your lung capacity is so low, and then you're not able to get the proper oxygenation you need to get you that relief that you're looking for, right? That also affects your pelvic floor. That also affects your entire even core muscle as well. So this could manifest into tight pelvic floor issues, pain during intercourse. This can also further spiral into cramps, right? Poor digestion, especially. And those are all interrelated into this process. So Bethany, there's much deeper issue beyond just the meditation issue there. Is multiple chemical sensitivity always caused by mold illness? No, it's not. It's not just mold, but also deals with your terrain being affected, right? So your detox pathway getting blocked, right? Hyper reflexive state in a high sympathetic nervous system. Your environment may not feel safe for you to thrive, right? Maybe there is a abusive relationship that's going on. Maybe there's a spiritual issue going on. So a lot of these things are interrelated into having poor tolerance to multiple chemicals. An anonymous person is asking, every time I try PC, I get very heavy, flush, my chest gets heavy, my breathing gets messed up, where I can't breathe. And I have tried it topically as well. I was reading that you shouldn't take PC due to choline. If you have respiratory issues, which I have, is a detox issue or is it sulfur? There's not those, but phospholipids, especially PC, is a signaling molecule. So start to turning different things within the cells and the Krebs cycle and all that, which is great, but also actually increases your bile flow as well. So this is a part that's really important. It's not the PC that you need at this point in time, is the actual nervous system dysfunction. Also, certain amount of fatty acid deficiency. So certain things like balanced oil could be one, or fish oil could be helpful in that scenario. But specifically is, how do we support your liver and your kidneys and your entire drainage pathway so that you are able to get things out, including solubilizing mold toxins? Because if you're in that hypervigilant state and you're not able to detox correctly because your entire piping system basically is blocked, it may end up having to cause worsening of it. So that's why generally about 90% of people can tolerate PC, no issue. But for sensitive client like you, this is where one-on-one work with me and really working this through with you is really important. So I would highly recommend you, again, book a call, right? The link is there for you. I'm only accepting, like I said, 12 people at this point in time for tonight. Allie's asking, can this program help rebuild the muscles and eliminate muscle fatigue? Muscle fatigue is my worst symptom. So lactic acid buildup from mold can be one of the critical things. So when you're having poor mitochondrial function, it goes into a acidic state where you have the high levels of lactic acid getting built up. So yes, you're going to have worsening of the muscle symptoms. So it's all interrelated. Would mold cause low GRF and liver enzyme elevation? Yes. So mold toxins, specifically ochratoxin and citrinin, can actually affect your kidneys and kidney tubules. So your GRF level can be low. The filtration rate. Yeah, GFR, excuse me, not GRF, GFR. Glomerular filtration rate can be low because you're not able to clear things out. And then liver enzyme being elevated for that purpose as well.